Good afternoon, guys. This is just Kiza again from the earwax specialist. This is a patient who comes in, one of my very, very regular patients, and what you notice straight away is there isn't actually your typical large blockage in the medial or the middle of the ear. This is just a piece of dead skin sitting right at the back of the ear. This is a piece of sort of almost keratin that hasn't been able to migrate itself off the eardrum. What usually doesn't help in this type of situation is the patient is a hearing aid user, and what you see of that eardrum is a tympanoplasty. It's a eardrum which has been grafted over with fascia just to sort of prevent infection because she's had a history of problems with her ears in childhood. So this is an ear that's been operated on, and as a consequence, because there's been a change in the cavity, you often find that the eardrum isn't radiating its skin away as well as it normally would do. So this is why sometimes it requires this little bit of a peel just to free up the eardrum, and also really more importantly give the patient some relief, because she does find that her ears get incredibly itchy, they're very, very dry. um, the hearing aid of course causes irritability, so this is what I'm doing now, just making it a little bit more comfortable for her, just removing that base layer of dead skin away from the ear. And you notice there up in the roof of the cavity as well, there's a piece of wax which is situated right up in the crevice where the ear has been operated on. It's quite a difficult place to get to, so I'm just attempting to remove as much of that skin that's almost deposited itself in that pocket as I can. It's not always easy in cavities like this, and I really ever work beyond my remit where I think it's not safe. I will sort of not pursue removing every iota of wax inside the ears, especially when it's very, very close to the eardrum or up in the roof in those superior quadrants, which are quite difficult to get to. Um, you always have to sort of make that sort of clinical decision as to what to do in that instance. I've advised to go back to a GP and just have that looked at, just to see if ENT might want to look at that further. I've now moved on to the other ear, and here you do see what I mean by almost crusty dead skin and keratin which has adhered itself towards the canal. Now this is incredibly bothersome, and the reason why is that because the skin can't migrate out of the ear, off the eardrum, it just sits there, and what often happens is it becomes dehydrated. As it becomes dehydrated, you often find it turns into a really sort of tough, crispy skin with sort of almost serrated edges, which sort of sometimes knock the ear canal on the movement of the jaw, makes patients feel very, very uncomfortable, sometimes causes a lot of pain. But in this instance, just an incredible amount of irritability. You notice just the general condition of the canal itself. You can see, a few lacerations, there's a bit of inflammation there. And that's because of the dryness that she suffers with. So what I'm doing here is just moving these flaky bits of dead skin away. It's almost like a callus that you get on your foot, right? Um, so we're just trying to get enough, or trying to build up enough pressure from the zona to actually start to shift it away from that part of the ear. I'm just trying to catch an end here. So once I catch that end and I catch the softer underbelly, usually you find you get more of this dead skin away. In that instance, you see, as I sort of just almost turned it on itself, there was that movement which allowed that larger piece of wax to work its way out. And again, we've just managed to lift it off and away from that lateral canal wall. We've got onto the other side of this piece of sort of keratin. And now what we're going to do is just try to just bring it away. And again, because of the proximity to the eardrum, you've got to be super careful. Can't rush it, just gently building up the pressure, and then finally going in with the Fenkel grips, which work fantastically well for this type of dead skin. You get a great sort of grip there, and away it comes. See you soon. Please subscribe.